Welcome back to Florida Pediatric TV. This is the end of week 5 of the 2013 legislative session, and Sam Bell and I are here to update you on kids' issues. The topic that's had the most conversation has been the Affordable Care Act issue about Medicaid expansion. Sam, I know there are a bunch of proposals out there. Where do all those stand?
Well, this is very interesting. The way it stands at this point is that the House has rejected the idea of accepting the federal money, which is 100% paid for the expansion for newly eligibles. The Senate, on the other hand, with Senator Negron, has proposed a variation on the bill which would place those newly eligibles in the Healthy Kids Corporation system, and it would be a managed care arrangement under Healthy Kids, but it would take the full amount of federal money. Since then, this week, Senator Bean has come up with an idea, something like a Senate proposal, which would reject the federal money but would use some state money to provide a limited amount of coverage for families and individuals under 100% of poverty. I think the jury is still out on what's going to happen there. We're hoping that the Negron plan will prevail and we will take down that money, because we're talking about covering another 1 million Floridians who currently have no insurance coverage.
But that remains to be seen what actually is going to happen, and there are several weeks left in the session, so Lord knows we have to keep close tabs on that.
I might mention, too, one of the things that's been of concern to us, and Dr. St. Peter and I have been working on it, and that is that if this program were to go ahead and be placed under Healthy Kids, we would replace the current Healthy Kids Board, which is obviously oriented to the health care needs of children, including pediatricians and other child advocates on that board. Since the board would be replaced by a broader board, we're proposing the idea of a sub-board of child advocates and pediatricians that would have the chairman of that board serve on the larger board. So there are pluses and minuses. Right now, the Healthy Kids Corporation covers about 250,000 Title 21 children.
Yeah, and that particular concept would help protect the issues of children, because children will be swamped with the 1 million adults who would come into the Healthy Kids Corporation under that plan. An issue that's really moved along this year is that of distracted driving. That looks like it's close to passage.
Yes, it is. The House bill is now on the calendar. The Senate bill is in judiciary, and we think that the distracted driving bill will pass this session of the legislature. Unfortunately, our booster seat bill does not seem to be having the same good result, and we may have to come back next year to revisit that issue.
And we'll remain then as one of only 2 states who don't have who haven't updated their booster seat laws, which is totally crazy. The epinephrine auto-injector in schools to prevent or to treat anaphylaxis, that's moving also?
Yes, that bill has passed the Senate and is in the last committee on education in the House, so we believe that that bill will become law this session.
And I believe the sudden unexpected infant death bill, including the permissive language for child protection teams to be involved, is also moving forward.
Yes, I think in week 6 that bill will go to the governor for a signature. That's been a very difficult bill because of the emotions surrounding SCIDs and the infant deaths, and so we've worked very carefully with the sponsors, and that bill, I think, will pass to the governor next week.
Another question that I keep getting from our members is, so what's happening with the Medicaid physician fee increase? And as you saw, I sent an email out earlier this week describing the steps that we've taken. We still have not heard from the Agency for Healthcare Administration regarding the self-attestation form. A lot of physicians have said, so are we really going to get the money? Sam, from our read of the Affordable Care Act, it doesn't seem that there's any way this isn't going to happen. In fact, the money is in this year's budget. Is that right?
That's correct. The money to cover this is in both the House and the Senate budgets. That was confirmed specifically with a question in the Senate Appropriations or the House Appropriations Committee meeting this week. So the money is there. Two things. First of all, we are now concerned that there may be a relatively short period of time to respond when that self-attestation form is made available, and so we need to stay on our toes and let everybody know as quickly as possible when that's available. The second issue there, and one that we've been working on, is how are they going to implement the back pay? And will it be a lump sum, and will we be able to tell what it's for? So we're working now with the staff in the Appropriations Committee on some proviso language that would clarify that the individual reimbursements.
Yeah, to expand on that slightly, one of the things that the Affordable Care Act allows is the differential payment between the current Medicaid rate and the new Medicare rate can both retroactively and in the future be paid as a lump sum, and our concern is that if that lump sum doesn't come with a detailed explanation of benefits, we will have no way to tell, number one, if ACA actually paid us the correct amount, and number two, which patient accounts to distribute that to. So Sam and I have worked with others on some proviso language that got submitted yesterday that would require the state, if they do lump sum payments for the differential, that they must allocate that to each patient account so we can actually track that in our accounting systems. Sam, there's still a lot to go for the rest of the session, but I think that covers the big items for this week. Please contact me. My email address is there. Let me know if you have additional questions or other issues that we can cover. And Sam and I will be back next week to update you on child health issues.